Hi everyone, in this video we're going to be covering a very interesting case study of a 78-year-old man back in 1986 who was dozing off on his rocking chair. When he slipped, he fell off and he hit his head on a hot coal fire. Now, as one might imagine, this man experienced full thickness burns, specifically in the left parieto-temporal region of the scalp. And what's interesting is that as little as 2 weeks after the burn, this man started noticing and reporting some hair growth. And if we kind of fast forward to 6 weeks after the burn, this man started noticing stronger and thicker hair growth. And what's most impressive, 4 months after the burn, we noticed a full scalp hair coverage where hair loss reversal happened not only in the site of injury, but 4 to 5 inches across on the other side of the scalp. This is pretty remarkable hair loss reversal. I mean, his hair now covers the span of his scalp. Now, it turns out this man is not an anomaly. This man is just one of many who have experienced unexpected hair growth as a result of an accidental wound. For instance, this 25-year-old Chinese man that you can see on the screen, he burnt his left cheek with boiling water. And 8 months after the burn, he started noticing hair growth on his cheek. And so this leads us to ask the question, how do wounds lead to hair growth? So in order to answer this question, we're going to start just by covering some context into why it is that hair loss happens, and specifically how pattern hair loss or androgenic alopecia happens. So we have the androgen hormone testosterone, and this gets converted into dihydrotestosterone or DHT by an enzyme called 5-alpha reductase. Now, why does this matter? Well, it's pretty well established now that DHT is found in greater quantities in balding scalps compared to non-balding scalps. And this is just one of many studies that corroborate this. So high levels of the potent androgen dihydrotestosterone and increased expression of the androgen receptor gene were found in patients with balding scalps. Now, conventional knowledge in the hair loss space typically says that dihydrotestosterone binds to the androgen receptor in the hair follicle cells, and this then causes the hair follicle and subsequently the hair strands to become thinner and thinner and thinner over time. And this process is called hair follicle miniaturization. Now, here we have another study that says that males affected with a 5-alpha reductase deficiency experience a lack of hairline recession. In other words, 0 5-alpha reductase means 0 DHT, which means 0 hair loss. And this is exactly how the world's most popular hair loss prevention drug, finasteride, works. This drug blocks the 5-alpha reductase enzyme, therefore lowers DHT throughout the body and, specifically in the scalp, which is what we're interested in. And this protects patients against future hair thinning. Now, addressing DHT, either with finasteride or dutasteride or otherwise, can work very well, but it works better in earlier stages of the Norwood scale. So for instance, if you're in a late stage of pattern baldness, say you're in the stage 6 of androgenic alopecia, yes, you can still benefit from DHT reducing drugs, but typically you get to a point after which the hair follicle has become so thin that it's not really going to grow back significantly, even if you completely remove DHT. And so why might this be? Well, here we have the dermal papilla cell cluster, which is a highly vascular tear-shaped pod which, amongst other things, supplies the hair follicle with oxygen and nutrients that it needs for healthy hair growth. And if we zoom into one of these cells, we can see that testosterone gets converted into dihydrotestosterone by the 5-alpha reductase enzyme. DHT then binds to the androgen receptor. The androgen receptor you can think of as a landing pad for DHT, and this causes the dermal papilla cell to secrete proteins like DKK1 or transforming growth factor beta 1. And here we have a study that says miniaturization of terminal hairs is a distinguished feature in androgenic alopecia and is frequently associated with perifollicular fibrosis. Now, fibrosis, or in other words, scar tissue, is triggered by transforming growth factor beta 1. This is a signaling protein that tells the body to lay down this fibrotic tissue. And here we have another study that says balding scalp dermopapilla cells secrete inhibitory factors that affect hair growth, namely transforming growth factor beta 1. And what happens is in early stages of pattern baldness, we have very low levels of fibrotic tissue. And in late stages of pattern baldness, the scalp is basically almost completely fibrotic. So you might be wondering, well, why is the body trying to grow fibrotic tissue on the scalp? And what happens is researchers have now found very consistently that balding scalps have chronic low-level inflammation around the hair follicle, right? So the hair follicle is inflamed, and as a response, the body is trying to lay down this fibrotic tissue by releasing TGF beta 1 in order to lower inflammation. So what happens is we notice this inversely proportional graph where as fibrosis increases in the scalp, this helps resolve the inflammation. So inflammation goes down, which is good, but fibrosis goes up, which now presents another problem, because the problem with fibrotic tissue is that it's like trying to grow grass on concrete. You're not going to get very far. Think about it this way. How often do you see hair growing on scars? It just doesn't happen. So if we kind of go back to the point of this video, which is, how can sunburns lead to hair growth? Well, there's a lot to unpack here and there's a lot going on, but we're going to answer this question by focusing on these three things: reduced fibrotic tissue, improved blood supply, and improved WNT signaling. So starting with reduced fibrotic tissue, here we have a study that says that while TGF beta 1 and TGF beta 2 promote scar collagen, TGF beta 3 appears to promote scarless wound healing with a normal collagen lattice. So what most likely happened in this man who burnt his scalp is his body's natural healing response released TGF beta 3, which then led to at least a partial reversal of the fibrotic tissue on his scalp, and he replaced his scar tissue with perfectly aligned cross-hatchings of collagen, which is what we would expect in healthy skin. Moving on to blood flow, it's very well established that balding scalps have lower levels of blood flow. And in this study, we can see that in patients with early male pattern baldness, subcutaneous blood flow was 2.6 times lower than the values found in normal individuals. And the conclusion was that subcutaneous blood flow of the vertex scalp was significantly less in bald subjects than in normals. And this other study says that VEGF, otherwise known as vascular endothelial growth factor, can be heightened as a response of a wound, and this can lead to angiogenesis. Angiogenesis means the formation of new blood vessels. So VEGF, improved follicle vascularization, promotes hair growth and increases hair follicle and hair size. So what's happening is that as a response to this man experiencing a burn on his scalp, what most likely happened is that the vascular networks feeding his hair follicles probably became more prominent, allowing the hair follicle to have more access to oxygen and various other nutrients it needs for healthy hair growth. And lastly, let's move on to improved WNT signaling. A deep dive into the WNT pathway would require an entire video dedicated to it, but the high-level summary is this. The WNT pathway is a network of proteins involving the transmission of signals from outside the cell to the inside through cell surface receptors that can lead to various cellular responses. And the WNT pathway is the crux of hair growth. It is so important. And as we can see here, there are various WNT pathways, WNT1A, WNT3A, 4, 5, and so on. And each of these supports healthy hair growth in one way or another. And here we have a study that says WNT signaling within the wound site leads to growth of new hair follicles, and WNT signaling is activated by wounding and participates in every subsequent stage of the healing process. So once again, what likely happened with this man who burnt his scalp is that his natural healing response led to an improvement in WNT signaling. So some of you might now be asking yourselves, is there a way to safely reproduce these results, without actually having to burn your scalp and risk a very serious injury? It turns out that, at least to some extent, the answer is yes. With percutaneous collagen induction therapy, otherwise known as microneedling, which can be done either with a derma roller or a derma pen, what you're doing is you're creating microchannels in the scalp that aim to trigger these natural healing responses that improve WNT signaling, that have at least a partial reversal of scar tissue and improve blood supply, and so on and so forth. Now, one thing I should mention is that if you do choose to do this and you choose to go with a derma roller, make sure you go for a high quality roller that has individual needles nested into the drum, rather than derma rollers that use serrated discs, as these have wider bases that create slashing wounds as opposed to uniform punctures. And because these are like 2D spears, if you will, they're more prone to bending, which can again damage the skin in a way that we don't want to. And lastly, if you're experiencing hair loss or one of your loved ones is experiencing hair loss, there's this absolutely free ebook that you can check out in the description below. It's absolutely free and it can help you understand why you're losing your hair, and it can set you on a path to slowing down your hair loss, stopping your hair loss, and even reversing it. And with that in mind, I thank you for watching this video. Have a great one. Subscribe if you enjoyed this video, and I'll catch you in the next one.